We're going to call to order the Early Childhood Subcommittee of the Education and Public Works Committee. Madam Chair, Lady Miss Rita Allison just stepped out. She has another meeting to attend. We were thankful that she was here to welcome us. We are live streaming, so I just wanted to let you be aware of that. Mr. Aremus, would you give us the invocation, please?
Dear Heavenly Father, thank you for this day. Thank you for allowing us to come together to do your work. Please lead us and guide us. In Jesus' name, amen.
Thank you. And members, would you introduce yourself? And we'll start on this side.
I'm Representative Jerry Govan, and I represent Orangeburg House District 95.
Melissa Aremus, Aiken County, District 84.
And I'm Paula Calhoun, representing Lexington County, and Subcommittee Chair, and the Chairman of the Education Public Works Committee, Ms. Rita Allison, is with us. Good morning. And I would like for our staff to introduce himself.
Thank you, Madam Chair. Good morning. I'm Pierce McNair. I'm Director of Research for the Education and Public Works Committee.
Okay, now that we have the pleasantries out, we have with us today Ms. Mary Lynn Diggs with the SC Head Start Collaboration Office, the Division of Early Care and Education, Department of Social Services. We also have Dr. Brannon Traxler, Public Health Director with DHEC, but we will begin the program with Ms. Diggs. Welcome.
Mask on.
You can if you want to.
Okay. Good morning. Again, I'm Mary Lynn Diggs with the South Carolina Head Start Collaboration Office, and we sent you a slide.
Ms. Diggs,
Yes.
let me find out where your slide is.
Okay. If not, we can start and tell you what's on it. Madam Chair, would you like for me to proceed while they're looking for the slide?
Absolutely, that would be fine,
Okay,
Ms. Diggs.
Okay. When you see the slide, you'll see a map of South Carolina, and I have a guest with me, Dr. Bruton? Dr. Arthur Bruton, who is the director of the Piedmont Community Action Head Start. That's in Spartanburg and Cherokee County. But he's here with me today because he's the president of the South Carolina Head Start Association. And by law, we partner with them. I'm Mary Lynn Diggs. I'm with the South Carolina Head Start Collaboration Office. We are located at the South Carolina Department of Social Services. And we brought a copy of the actual section of the Head Start Act. This is the Head Start Act. And these are the Head Start performance standards. Head Start is a federal to local program. It is, and when we emphasize federal to local, 80% of the dollars come from the federal government, and community organizations have to have a 20% match. There are no state dollars in Head Start. So you'll see on the slide that we are sending to you that the federal government sends approximately $150 million to South Carolina to serve children 0 to 5, whose household income is 100% of poverty or less. So that's approximately $25,000 or less for a family of 4, 100% of poverty or less. Now, there is a Head Start presence in 45 of the 46 South Carolina counties. As we said, Head Start programs are federal to local. The award is made to grantees, entities that apply for the grant, compete for the grant, and the award is made for a 5-year iteration. There are 16 Head Start programs in South Carolina serving children ages 3 to 5, and that is the original iteration of Head Start. 12 of these programs are under the sponsorship of community action agencies, 4 are with school districts, and funding comes from the Region 4 Office of Head Start, that's in Atlanta. There are 4 South Carolina migrant Head Start sites. East Coast Migrant Program is based in North Carolina and serves as the grantee, meaning that's where the money goes. But East Coast serves everybody on the East Coast from a migrant perspective. And the services are provided to children 0 to 5, and the funding is awarded by way of the Office of Head Start, meaning by way of Washington. And then there are 17 early Head Start programs providing services to children 0 to 3, and the funding is processed through the Region 4 Office of Head Start in Atlanta. And the sponsorship includes community action agencies, school districts, local First Step School Ready partnerships, and a United Way affiliated agency. There is one American Indian Head Start program in South Carolina, the Catawba Indian Nation, and the funding is made possible through the American Indian Program branch of the Office of Head Start. And those children are children ages 0 to 5. Early Head Start and Child Care Partnership grants have been made available and awarded to South Carolina. That's the latest iteration, and we emphasize that it is federal money and it is competitive. Of that process, 3 of them are local First Steps partnerships, a community action agency early Head Start program, and the South Carolina Association of Community Action Partnerships. Serves 14 counties. And when we say an early Head Start child care partnership, that means that they partner with a private child care and they layer the Head Start performance standards. They don't blend it, they layer the services. So in that private setting, you'll have children whose parents pay, children who receive child care vouchers, and then you have children who are Head Start. And you may want to put a star next to it. There is no cost to attend Head Start. It is federal to local. It is specifically for children who 100% of poverty or less, and there is no fee. And one caveat that we are very proud of in our partnerships, South Carolina is the first state in the United States to have an extended day opportunity by way of child care funds, meaning after 2:30, South Carolina Head Start children have the opportunity to be in place for aftercare, and their parents receive child care vouchers through a partnership that Head Start has with the Office of Child Care in South Carolina. That served as a model. It will now be a national expectation. And South Carolina is the first state and the only state where it is statewide. Others are doing it district by district. As of December of 2019, South Carolina Head Start served 12,153 children in 225 centers. 80 of those children were American Indian children, and 385 were served in home-based settings. Of the total served, 4,228 were age 4. In addition, 4 grantees serve as state-funded 4K providers. So in what you know as the SURDEP project, Head Start is coded as a private entity in SURDEP. So 4 Head Start programs receive SURDEP funding, but through First Steps. And it was a caveat of looking at Representative Allison. Thank you. There's the map. So each of you will receive the map if you don't have it at your desk. That is the map. Thank you so much, Representative Allison. And Representative Allison was active with and very aware when the SURDEP was moving. There is a document that is sent to the South Carolina Education Oversight Committee every year. It is a census of where Head Start children are. That is an agreed document between the Office of Head Start in Washington and the South Carolina Education Oversight Committee. That was used as a model of tracking when the SURDEP bill was being negotiated. So Head Start at the federal level and the Collaboration Office worked to design what you know as the SURDEP, and at that time it was called CDEP. As of December of 2020, and we have sent this census because by that federal agreement, we are to send the census to the Education Oversight Committee, and we send a census as of December of each year and as of June. So that committee has received the census showing where Head Start children were served by age, and it also shows where children are being served in Head Start if they are foster children or if they are homeless. Please keep in mind that according to the Head Start Act, Head Start must serve 10% of children with an identified special need, meaning those with an IEP, with an identified special need. In addition to that, automatic admission is for students and families who are foster and who are homeless. Head Start, by federal law, is included in the McKinney-Vento Homeless Education Act. So we're gonna share a little bit, just a little bit. When we talk about Head Start, we talk about the other America. So Head Start is a part of the war on poverty. Head Start started in 1965. If you are an E.P.W fan, you watch Sesame Street. Sesame Street is a Head Start initiative. It is Head Start on film. And in that other America, it was identified that there were 10 counties in the country that were the poorest. One of them was a South Carolina county. So if you look on that map, that county in the early 1960s was Jasper County. And the congressional delegation from South Carolina pushed the envelope that there would be a Head Start presence all over South Carolina. That is not the case in every state. In 1965, Head Start dollars were awarded to public schools for what's known as transition, for the summer program tied to the summer feeding program. After that first year, the federal government embraced the concept and took the money back and awarded it to community-based organizations to ensure that children who were 100% of poverty received the services. That is not the best part of the story, in that the money was pulled back because some children were not getting the services in some states. So Head Start became a federal to local program after the first year, having been in public schools. So at that time, the federal government placed it under the Economic Opportunity Act. So you know that as community action agencies. And community action agencies started in 1964 as a part of the war on poverty. So Head Start was co-located in a community action agency along with what you know as Job Corps, VISTA, the TRIO program, and legal aid, and community health centers. So they have all kind of split out to do other things. So we thought that you would want to know a little bit about how Head Start started, where it started, and where it is. And in South Carolina, it is very important that we are aware that it has always had a footprint in our state. As we pointed out, there's a Head Start presence in 45 of the 46 counties in South Carolina. So as of today, our numbers are different. As of December 2020, Head Start was serving 7,157 children in 266 centers, and many of them were served in home-based settings. So we know that we are in a hybrid mode for some, we are in in-person mode, and we are in remote. And Head Start is moving forward in the process of coming back into place. In addition, 2 grantees at present are serving as state-funded 4K providers, serving a total of 20 children during this pandemic. And those services are in person, others are in person, virtual, or hybrid. Now, one thing that we wanted you to be aware of, we pointed out that Head Start is pure federal money. The Head Start Collaboration Office is located at the Department of Social Services, and we brought a copy of that section of the Act for each person. The Head Start Collaboration Office funding is awarded to a governor of the state and assigned to an appropriate entity. In South Carolina, it is assigned to the Department of Social Services. In its first 15 years, the grant was at the Department of Health and Human Services. It is a 5-year iteration. It cannot be moved within that 5-year term unless the federal government agrees to its moving. And they generally don't move it until the end of the 5th year if a governor who is assigned chooses to move it. The Head Start Collaboration Office is located in the Division of Early Care and Education at the Department of Social Services. I'm the Head Start Collaboration Director. Now, we brought a copy of this because there's some other things that you deal with every day, and you have gotten some wonderful presentations about the Early Childhood Advisory Committee. The Early Childhood Advisory Committee is a part of the Head Start Act. It's a mandate for states. So you see so when you read this, you'll see the membership expectation for an early childhood advisory. South Carolina's Early Childhood Advisory Committee is located within and a part of South Carolina First Steps. That was a gubernatorial designation for the Early Childhood Advisory Committee. The Head Start Collaboration Director must be on the Head Start Child Care Advisory Committee, which means that the collaboration director in South Carolina does 2 things with that, the First Steps Board and the Early Childhood Advisory. So when you go to that meeting, there's one, and Representative Govan is in those meetings. So you have a name tag that says First Steps, and when the agenda ends, you flip it, and then the Early Childhood Advisory Group is the entity, and it is a federal act. And we appreciate South Carolina participating. There's one sad part. We do not receive money in South Carolina for the Early Childhood Advisory Committee. There was an award of approximately $1.5 million when the committee started its work. And they were able to access a portion of that money, but a succeeding governor chose to send the money back. So South Carolina does not receive money for the Early Childhood Advisory Committee, but it is housed at First Steps. Yes, sir. Oh, okay.
Oh, no,
Okay. Okay. Again, it's comprehensive services, and we want to emphasize, quite often it is missed that a Head Start teacher is expected to be a baccalaureate level trained person in early childhood. A Head Start director must be a baccalaureate, at least a baccalaureate and above trained person. All Head Start centers in South Carolina are licensed. That was an initiative put forth through and with the Collaboration Office 20 years ago. So we're the first state in the region where all of our centers are licensed. Now it is a federal mandate. We mention that because Head Start is designed to be a test ground. If it works in Head Start, it's going to work somewhere else. It will be a part of everybody else's work. So the licensing piece has now evolved into what you know is a requirement for licensing for Head Start and then other child cares across the country, even looking at space and ratio. Again, Head Start is designed to be a test ground. Know that, and we pointed out that there's parent involvement. We understand that the ECAC will be working with First Steps to have a statewide parent council. Head Start, by law, must have what's known as a policy council. It's 51% parents. That was in the original act in 1965. And that policy council partners with the governing entity of the grantee, meaning who receives the grant. They are partners. It's a board of a community action agency, and hopefully a school district understands that they must partner with the policy council made up of 51% parents. So those parents, yes, have a voice, but they also learn what is and is not best for their children, and they are taught the fiscal implications of either the grant or what is being provided in the service. Last week, we had a robust fatherhood initiative, and that is a big piece for South Carolina Head Start, and it is the model for the region, and there were participants from 7 other states. I see you get ready to ask me a question. Yes, ma'am.
Yes, ma'am, I do. With the makeup of the policy councils of parents, 51% parents, how often do they rotate off?
Generally every 3 years, correct?
5 years. They can
Coming up.
serve up to.
This is the president of our Head Start Association.
Their terms are for 1 year, but they can serve a maximum of 5 years on the policy council, and then they'll have to rotate off.
Okay, don't go. Okay. Are there any other questions about that?
Let me clarify why I asked that question. I was just wanting to know how many parents we were reaching in a period of time. So if you know that the advisory council's catching 51% of the parents, I was thinking that if it was rotated at least every year or so, and it's not an extended period, we'd reach more parents in that area. So that was the purpose of the question.
They also required, each center is required to have a parent committee as well, and the parent committees usually meet monthly.
Okay.
That usually composes most of the parents in a particular center. For example, one of our centers may have 200 children, so we anticipate to have at least some participation during the course of that program year from 100% of those parents in some kind of activity at that particular center. But the meetings are usually held once a month with the parent committee.
That's wonderful information. Thank you.
Okay. In addition, as we mentioned earlier, federal law requires that 10% of all children in Head Start are to be children with an identified special need, meaning an IEP. At one time, Head Start could issue the IEP, but federal law was adjusted under 619, and now school districts issue the IEPs, but Head Start does the actual screening and the referring, and we are to meet a 10%. There's a 10% mandate. It's not always met, but that is a mandate. So that is something that we're working hard on in South Carolina, as school districts have to do more with that, and we know that school districts are challenged with having enough staff persons to actually provide those services. But it is a Head Start mandate, and if it is not met, it jeopardizes the funding for our state for the 619, for the IEP process. And of course, our children in the 0 to 3 who are identified must have the IFSP, and that comes from Part C at the Department of Health and Human Services. We want to emphasize again that our children are our Head Start children are automatically, it's an automatic crossover for Medicaid services, and that's in the federal act. So Head Start, in its comprehensive service, finds a dental home with a board-certified dentist, and Head Start is required to find a medical home for Head Start children. So we're at 90+% in South Carolina of that identification and working with those sources. And there's a partner sitting behind me, the state WIC director, and his first year here, we probably wore him out over the adventure one day. And we work together to access something that is a model for the country now. There are WIC vans that go around the state. You have 4, correct? There are 4. But the application really was for 1. But it worked so well that the federal government came in and met with us and told Barry, well, you got to have one for every region. So WIC vans come into or go from place to place in South Carolina by region and help parents to be reviewed and make application for WIC. And some partners may ask, well, why do they go to the Head Start Center? Well, Head Start is federal. It's federal to local. And WIC's money is federal. So when you go to a Head Start Center, you can use their copy machine, you can use their water, you can use their electricity. So if there's a question about why they go to Head Start, it is a federal partnership, but it is for everybody. Are there any particular questions? Yes, Representative, go ahead.
Well, I don't have a question. I really want to just commend you for the job you've done over the years in terms of enlightening us with this program. And even before the creation of First Steps in terms of the state's initiative, Head Start was basically carrying the weight for early childhood education and services in this state. I'd encourage the committee to look closely at the collaboration. It's actually a national model, and to the credit of Representative Allison and those of us who were here for a while, I think when the state started its initiative in terms of making early childhood education a priority, that first, actually, Head Start was one of those entities that we looked to as a model, and as well as North Carolina. And I think what we've been able to put together, and there's always room for improvement, is something very special, and that's why you see some of the national awards and other recognitions that we received. So,
Thank you.
outstanding job.
Okay, and we want to emphasize too, we shared with you that our 10% of our children must be children with identified special need, and that we do serve foster children, and we do serve homeless children. But there is a process in place called the Quality Rating Improvement System, QRS, and it is tied to the Child Care Block Grant. It is a rating system that must be at the highest level. So remember, Child Care and Head Start both come from the Administration for Children and Families. Child Care dollars are block grant dollars. Head Start dollars are not block grant dollars. They are federal to local dollars. However, the mandate for QRS is that by September, Head Start programs will be under the QRS system. At present, we are moving in that direction. For a long time, the majority of the NAEYC accredited centers in South Carolina were Head Start centers. It was an initiative to set forth the quality piece before QRS came into play. So you want to look closely at a quality rating improvement system. By the same token, there is a process that is in place with the State Department of Education. It's called Pyramid, and it deals specifically with serving children and their families who have an identified special need. It is an iteration of and a follow-up for what was known as CEFL. So CEFL was the beginning of the process out of Vanderbilt University. And CEFL is now what's known as Pyramid at the federal piece, but Head Start was the CEFL site all over the country. Now it is called Pyramid, and it is for children with an identified special need, and how they are served, and how state government and how institutions of higher education serve those children and their families. So we cannot emphasize enough that Head Start is designed to go forward, not saying that work that all of us do together to move forward is not good, but keep in mind that if it is done in Head Start, from a federal perspective, it will be done with everybody who gets federal dollars. So you may want to look closely at your Head Start programs in your communities, so we won't be kind of running up against each other or double dipping in that process. So did you have a question?
I just want to kind of echo Representative Govan, and somebody had their call for this morning because you are just spouting it all out, and I'm just loving it. You've got so much information, and I think it's just going to take a minute to digest everything. I'm the newbie on the block into this committee, so just trying to put all the puzzle pieces together, but I love hearing about the WIC vans and how it was a partnership and bringing the two together, because that's me. I'm all about efficiency, and everything that we could tie together to reach the masses is kind of where I am. So, but anyway, I just want to commend you on everything that you're doing.
Thank you. Well, I've just been reminded that we need to share with you that Head Start is the lead from a national perspective on what's known as a two-generation approach. I know you've been discussing that in some of your meetings. That is in place already in Head Start. So we don't want you to have to work too hard to find out things. So it's already in place in Head Start. And again, if it works in Head Start, then it will be in other places. An example would be homeless children now being served with CCDF dollars. That was not always the case, but it worked in Head Start, so the federal government placed it in the guidance with child care. So again, Head Start is a test, it is a pilot. Its emphasis is on children who are 100% of poverty or less. So if the question comes, why didn't you take a child and this child has a Medicaid card, that doesn't mean that the child is 100%. They might be 200%, but Head Start must first serve children who are 100%. And yes, we have about a 7% enrollment of children who are above the 100%. They're like at one, we can get clearance from to be 135, particularly if there is a early childhood desert in your area. And again, keep in mind the qualifications. Now, a Head Start teacher by South Carolina code is not allowed to have a teaching certificate. But a South Carolina Head Start teacher must have a baccalaureate degree. Okay? Okay. Two.
All right. Quick question. You just referenced the pyramid program with the partnership with the Department of Education. Is BabyNet tied in there also?
It is.
Okay.
It is, because it's a crossover. But the focus on pyramid is the 3 to 5, but you must cross over because the disability services with the IFSP are for children who are babies up to age 3, and at 3, you get the IEP. So
Okay.
in that cross piece, there must be. And there is a pyramid council, and you may want to look at that, and there's a federal work group, a required federal work group for the pyramid in each state. And it's tied to their $619.
Thank you. Representative Govan?
Actually, this is something that I think that we've asked about. What is your capacity? What percentage are you operating at this point in terms of compared to your capacity? If that makes sense.
I understand. Earlier, we noted that at the beginning of 2021, we were serving, and I think we shared that with you, a little over 7,000 children. We're usually just under 15,000. But we are gradually coming back into place, but we'll be able to share that with you again. And as we pointed out, now I have a copy, and we're not going to step out of line, but Pierce probably has this in his book somewhere. There's a Education Oversight Committee report that we must do every year, and this is what it looks like. Now, and it's in color, so ask Pierce. You don't have, but the Oversight Committee has this report, and it will show you where children are. So you may want to ask them for the South Carolina Head Start census for December of 2019 and the Head Start census for December of 2020. And it will show you the service area by county, the number of centers in that service area, the number of children enrolled by December 1 of that year, the number who were 3, the number who were 4, the number of pregnant women, the number of children who receive home-based, and it will tell you how many Head Start classrooms there are by county, and the number of homeless children, and the number of foster children. And the last page will show you how many children were in place under the SERDEP 4K, and in which counties where it was served by way of a Head Start grantee.
Ms. Diggs, I want to thank you so much for this presentation. It has been very well delivered,
Thank you.
very informational, a lot of information. And I will be calling you to kind of dissect it too, because it was so much.
Okay.
But thank you for the presentation
Thank you.
today, and
Thank
thank
you
you
for
for being
having us.
here
Thank
to
you.
provide this information.
Thank you.
Next Dr. Traxler.
Thank you. Good morning, Chairwoman Calhoun, Representative Govan, and Remus, and all of our guests here. Thank you for having us. I'm Brandon Traxler. I'm the new Public Health Director at DHEC as of, I guess, a couple of weeks ago. I'm going to talk to you about some of our early childhood programs that we do that touch early childhood. I also have with me, if there are further questions in terms of some of the details, two of our Bureau Directors for Public Health, who a lot of these programs fall into their areas. So I have Kimberly Seals and Barry Kelly, who are our Maternal Child Health Bureau Director and our Community Nutrition Services Bureau Director. So looking at only early childhood, some of the services that DHEC provides on the public health side that touch individuals during their early childhood, we certainly have that special supplemental nutrition program that you're familiar with, the Women, Infants, and Children, WIC. That is, we'll speak more about later, but is under the Food and Nutrition Services for the USDA. And that certainly provides the nutrition education, the nutritious foods, the breastfeeding support, and does healthcare referrals for women and who are eligible and children who are eligible up to age 5. We also do postpartum newborn home visits. And this serves the families with, obviously, as it says, the newborn infants, and focuses on providing resources to those mothers, particularly if the mother or infant has a medical diagnosis or special need. They get this voluntarily, where our visitors go to their homes after the mother and infant are discharged from the hospital. They do an assessment of the home environment of the mother and the child. They observe feeding and bonding, do a complete physical assessment of the newborn, and certainly a limited appropriate physical assessment as needed of the mother. And our Title V grant provides the funding to these mothers and children. My apologies.
Nope, we have a question.
Yes.
Curious, I know in South Carolina, we have programs such as Nurse Family Partnership and others. Does the postpartum newborn visit work with those programs, or how is that delivered?
Certainly. So those are, the Nurse Family Partnership is another program, correct, that could, I suppose, be its own separate bullet that is separate from the postpartum newborn home visits. Certainly, they could work together, but they focus on different families. The postpartum newborn home visits are a one-time visit usually, where they're targeting these mothers and children and helping connect them to resources then that can serve them, whereas the Nurse Family Partnership is that 2-year, ongoing support and communication with that mother and child. Yes, sir. So there were a total in the year 2019, the fiscal year, of 6,950 postpartum newborn home visits. And it was not quite 2 to 1 for mothers and children in terms of mothers and infants in terms of the reasons why they were done. We also have the First Sound, which is our newborn early hearing screening. It's the detection and intervention. And this provides, it's legislatively mandated, it provides that hearing screening for babies, any that are delivered in a hospital that has 100 deliveries or more per year. So on average, about 97.5% of newborns in South Carolina are screened via this program. And certainly infants who don't pass this initial hearing screening in the hospital after birth or have certain risk factors are sent for rescreening then after they're discharged. Text for Baby is a mobile information service that is free, that is used to promote the maternal and infant health. The pregnant women and new moms can elect to sign up for it, and they will receive information via text message. It also provides resources and can help connect them to both other resources in the state as well as nationally. So it's the coordination center is within Ms. Steele's bureau with the maternal child health. Our newborn screening program, I believe you probably are all familiar with. That is our lab-based program where newborns in the state, it's legally mandated, look for inborn errors of metabolism after the child's born. It looks for over 60 metabolic and genetic conditions that are recommended by the federal HRSA, as well as by some of the national colleges, such as medical genetics and certainly the March of Dimes. And it identifies infants early on so that appropriate intervention may be taken for those with many of these. Looking at programs that DHEC provides that are services for early childhood that also extend beyond early childhood, you'll see here that we have certainly communicable disease surveillance and control. I think everybody's become familiar with that during the COVID era. Certainly birth to death, those surveillance and control measures are done. That includes things specifically with early childhood like the school and daycare exclusion list. That is provided by the Communicable Disease Bureau to give the requirements to daycares and child cares as well as schools as to which conditions require a student or a child to be out and for how long, et cetera. Immunizations is also something that we provide in early childhood and beyond. Certainly most immunizations are done in childhood, though as we know, they continue, as we're seeing now even with COVID with adults. Our lead screening program is a great collaborative program between a couple of our different bureaus within public health, as well as with our environmental affairs section of the agency. We provide education materials for the healthcare professionals and, of course, families, and do surveillance of blood lead testing, do case consultation for children up to 16 years old who are screened and found to have an elevated blood lead level. And certainly the ones then that have qualifying elevated blood lead levels, we do environmental assessments of those. And so there is, a lot of this is funded through Title V funds that DHEC receives. And there is also a agreement that are in place with Medicaid, with DHHS, for a lot of the environmental assessments. Excuse me. Our child passenger safety program is, I think most people would know as the car seat safety. And it's within our injury prevention division. And they do have certified technicians in child passenger safety who can provide guidance and help install car seats throughout the regions to ensure that those children are properly protected to the fullest extent possible if there were to be a car accident. The Children and Youth with Special Healthcare Needs is a large program that has basically financial assistance for a number of other programs. You'll see there the Children's Rehabilitative Services does office visits, durable medical equipment, prescriptions, and other needs, provides payment for those from birth through 18 for the children that have a qualifying diagnosis. The orthodontic program demonstrates, providing funding for assistance for orthodontia. They served over 3,000 patients from 2018 to the end of 2019. The hearing program is not to be confused with the hearing screening program that I spoke about a moment ago. This is for hearing impaired patients. We help provide funding for a number of their needs, both equipment and visits. And they served over 2,000 or right at 2,000 people looking at that 2019 year. They provide funding and assistance for programs for hemophilia as well as sickle cell. They give support to 4 sickle cell organizations that give services then to those individuals with sickle cell disease and their families. And our special formula program is basically kind of the follow-up to the newborn screening for many of those newborn conditions that the newborn screening program detects. That are these errors of metabolism. Much of the treatment involves special formulas that either contain or don't contain, depending on what the need is, specific amino acids or proteins, enzymes. Our funding for our early childhood services is a mixture of state and federal funds. That federal funding, as you've heard me mention a couple of times, it comes significantly from the Title V Maternal Child Health Block Grant. And then the WIC program comes for that special supplemental nutrition program for women, infants, and children at the federal level. Looking at that Title V Maternal Child Health Block Grant, it is the only federal program that's really dedicated to improving the lives and health of women, children, and families. And it's a partnership between the federal government and state public health that promotes and improves maternal and child health. And it does include those with special health care needs, as I spoke about a moment ago, the children and youth with special health care needs. They do the health assessment and follow-up services, particularly focusing on low-income children, provide access to preventive and primary care, which, as we know, can certainly prevent many of the complications later on. And they work to reduce infant mortality and, of course, decrease the chance of preventable conditions and diseases. The funding from this block grant is allotted to states based on the proportion of low-income children within the state compared to nationwide. Our current state allocation in South Carolina is $11.6 million. And as you can see here on this slide, you can see the different populations that are being served, where some of the different funding goes. The state has to match every $4 from the federal block grant with at least $3 from the state. We are exceeding that currently. We provide more state funding than federal is provided. This supports over 400 full-time employees who are across the 4 public health regions in the state that provide the services I spoke about earlier. There are requirements with this block grant funding from the federal government. At least 30% of the funding has to be used for the services for children and youth with special health care needs. At least 30% also must be used for preventive and primary care services, again, looking to try to decrease the risk of those preventable diseases and conditions. And certainly no more than 10% of the funds can be used for administrative costs. It does help pay the salaries, as I said, more than 400 full-time employees in our county health departments, as well as the supplies and equipment to provide these services for the women and children that include, ones that have crossed many of these programs I've spoke about: physical assessments, nutritional, developmental, immunization, hearing screenings, the dental outreach program that I know works with Head Start, and so we certainly enjoy that collaboration as well. Looking at the WIC program, the Special Supplemental Nutrition Program. I'm sorry, do you have, yes,
Yeah, I
ma'am?
do have a question.
Yes, ma'am.
It references 4 public health regions. Do those 4 public health regions coincide with Head Start, or are those different regions?
No, ma'am, those are DHEC's public health regions, and I believe, we can get you a map of those, but we have the Upstate, Midlands, PD, and Low Country.
Okay.
Within each of those public health regions, however, there are numerous sites, at least one in every county, the county health departments, as well as several other standalone sites separate from the county health departments.
Okay, thank you.
Yes, ma'am. Looking at the WIC program, it provides that nutritional education and resources, does referrals to community services and other healthcare providers. They certainly encourage and support and educate on breastfeeding, and they encourage and support and strongly provide educational materials on the nutrient-dense foods and help provide supplemental nutrition that way for women and children. And it's especially focusing on those critical times of growth and development. So that's why it's looking at pregnant and postpartum women, and then children who are, including breastfeeding women, and then children who are infants up through the age of 5. So that critical period of time in a baby's development from before it's born to till it's stage 5. I want to give a big kudos to Mr. Kelly and his team. The number you'll see there at the bottom of this slide, they, despite COVID going on during the year 2020, added almost 8,000 participants to the WIC program. And that is, I believe, in large part due to the fact that under Mr. Kelly's leadership, they transitioned to an e-WIC program, electronic, beginning in November of 2019. So certainly very timely. They had that up and running and underway before the pandemic hit, and certainly limited in-person services. So despite the limitations for what we could do in person during the year 2020, they saw an increase of 8,000 participants statewide. As I mentioned, the funding for WIC comes from the U.S. Department of Agriculture, Food and Nutrition Services. It's currently $106.7 million. It does fund also 415 full-time employees, and then another partially funds another 564 staff throughout, again, our 4 public health regions, and that's on the WIC and breastfeeding peer counselor grant. The funding is very strictly limited and regulated by federal law, guidance, and oversight. The funding, as I said, you get $105 million. That's food funds, manufacturer rebates, and administrative funds. $1.6 million is for the breastfeeding peer counselors grant, to encourage and support women in breastfeeding their infants. And then there is almost $150,000 for the farmers market nutrition funds. Some of that is administrative and matching funds, but most of it is for food funds to help encourage participants in the WIC program to utilize local farmers markets to get those nutrient-dense foods and to buy them sourced locally here in South Carolina. And certainly, I'm happy to answer any questions, and if I don't have the answers, I'm happy certainly to turn to Ms. Seals and Mr. Kelly, and you may also contact me at any time on this or any topic. My email address is on the slide.
Dr. Traxler, thank you so much for all you have done for the state of South Carolina over the last year, and your involvement with the vaccinations and the COVID-19 programs. But also thank you for this presentation today. It was very informative. Members, do you have any questions, staff?
During this COVID crisis, and certainly in terms of these programs, which are essential in terms of providing some continuity in the lives of a lot of people, and job well done.
Thank you, and I will take that back to the team because it's absolutely a team effort.
We do have a question.
With the programs, especially for women and infants, do you provide them with information, contact information, brochures, what have you, about early childhood education opportunities like Head Start or CERDEP or whatever?
I do, Mr. Kelly, we do. Mr. Kelly may be able to speak more to it, but certainly a lot of what a lot of these programs do is provide resources, information and contact information on other resources. And as you heard earlier, there is certainly the partnership there. I mean, even locating the vans, at Head Starts to try to help collaborate there. And Mr. Kelly has already spoken with me, wanting to do even more outreach and such with the vans. And so we really hope as this pandemic continues to calm down that we'll be able to get out and about at more places.
Thank you so much for being here today. And Ms. Diggs, with the Head Start program and your staff, thank you for being here too. We really received a lot of good information, and the collaboration and this going on between the agencies here in the state really uplifts us. So thank you so much.